Welcome back, future doctors. Today we're tackling a USMLE Step 1. Question 8, 50-year-old man with headache and shortness of breath. Let's get started. A 50-year-old man comes to the office for a follow-up examination. He has a 2-month history of headache and shortness of breath with exertion. He also has hypertension treated with hydrochlorothiazide for the past 2 years. His blood pressure is 180 over 105 millimeters of mercury. Ophthalmoscopic examination is most likely to show which of the following in this patient? 1. Arteriovenous nicking. 2. Melanocytes in the uvea. 3. Optic neuritis. 4. Posterior subcapsular cataracts. 5. Tractional retinal detachment. Let's break down the key information in this patient's case. 1. A 2-month history of headache and shortness of breath with exertion. 2. Hypertension treated with hydrochlorothiazide. 3. Current blood pressure, 180 over 105 millimeters of mercury. Given the patient's history of hypertension and current elevated blood pressure, we need to consider the ocular manifestations of chronic hypertension. The most likely ophthalmoscopic finding in this patient is related to chronic hypertension. Chronic hypertension can lead to changes in the retinal blood vessels, which can be observed during an eye examination. Option A, arteriovenous nicking. This is the correct answer. Arteriovenous, or AV, nicking is a sign of chronic hypertension. It occurs when thickened arteriolar walls compress the veins at points where they cross, leading to focal constrictions. Option B, melanocytes in the uvea. Melanocytes in the uvea are normal and not related to hypertension. This option does not fit the clinical picture. Option C, optic neuritis. Optic neuritis is inflammation of the optic nerve, often associated with conditions like multiple sclerosis. It presents with vision loss and pain, not typically related to hypertension. Option D, posterior subcapsular cataracts. Posterior subcapsular cataracts can be associated with prolonged steroid use or systemic diseases, but are not directly linked to hypertension. Option E, tractional retinal detachment. Tractional retinal detachment is usually seen in conditions like diabetic retinopathy, where fibrous tissue pulls on the retina. It is not a typical finding in hypertension. Therefore, the most likely ophthalmoscopic finding in this patient is arteriovenous nicking, indicative of chronic hypertension. And that's how you tackle a USMLE Step 1 question on the ocular manifestations of hypertension. Always consider how systemic conditions can present with specific physical exam findings. If you found this video helpful, please like, subscribe, and hit the notification bell for more exam-crushing content. See you next time.